We're going to start Subcommittee 1, Health and Environment Affairs. First on our calendar is H3956, which is a bill by Representative Howard to establish the South Carolina Rare Disease Advisory Council within the Department of Health and Environmental Control to provide for the purpose, duties, memberships, and funding of the council, to establish certain reporting and meeting requirements for other purposes. The council will solicit comments from the public to survey needs of rare disease patients, caregivers, and providers. Before we acknowledge any of our speakers, any members of the subcommittee, I know you've had a chance to review the materials. Do you have any discussion before we go to any of the speakers? Seeing no discussion, Chairman Howard, is there any information that you would like to give us in reference to this bill?
Thank you, Mr. Chairman. I've met with quite a few individuals for quite some time, for several years, who have family who suffer from rare disease, particularly the hemophilia community, who sometimes will end up in the emergency room, and healthcare professionals not being extremely aware with their conditions, and sometimes they don't get priority treatment because the healthcare professionals are not really aware of the hemophilia patients and the severity of it. And so this group feel that to establish this advisory committee and help people become more aware of hemophilia will certainly help constituents in the state of South Carolina that suffer.
Okay, thank you, Mr. Chairman Howard. Is there any discussion from any members of the committee before we go to our public comments? Yes, ma'am.
Thank you, Mr. Chairman. Representative Howard, my question is, well, let me say this. So I have a nephew who he has repeatedly had issues with randomly passing out. They've tested him for everything under the sun. They still don't actually have a diagnosis. So I think this is a little near and dear to my heart, because I feel like we do need somebody who is looking at these things and versed in them. But I guess the question is, we were hung up for so long. Would this council also be working in conjunction with the military? Because, you know, they were looking at him on the base, but I find that until it gets to a certain stage of how worse it is, you know, they don't really take them off. And I guess I wonder, is, in your mind, would they be working not just with the public, but also with our military as well for issues that they have medically arising?
Yes, I would think so. They, you know, my conversation with them, that they seem to be very open to anyone who have a rare disease issue, particularly hemophilia. And so with the advisory council, I think that would be a good time for people involved or on the advisory council to get advice from the community, from citizens, and I'm sure that could be incorporated.
Just make a comment.
Yes, ma'am, Ms. Brawley.
Thank you, Mr. Chairman. I just want to say that this is something that you would have thought we already had in South Carolina. And given the number of just the agencies that have an interest in this and making certain that these rare diseases are well known to the people who are treating these patients, I think it's a really good thing for us to try to pull people together in a room to try to figure out how best to offer care. So I want to just commend you. I don't know anyone who has hemophilia, but I do know that it is a very serious, life-threatening disease.
Folks on teams, are they ready? They're ready? Okay, great. Ms. Martin, are you there? You ready?
I'm here. Can you hear me?
Yes, we can hear you now. Thank you.
Thank you. Thank you for the opportunity to provide oral testimony to the Health and Environmental Affairs Subcommittee today. My name is Suzanne Martin. I live in Greenville County, and I'm the Executive Director of Hemophilia South Carolina, the state's only nonprofit advocacy organization that represents individuals and families who are diagnosed with bleeding disorders. More importantly, however, I'm a mother of 5 children, 3 who live with hemophilia, an inherited genetic bleeding disorder in which their blood is unable to make a proper clot. Without medical treatment, uncontrolled bleeding can lead to debilitating damage and pain and life-threatening conditions. Currently, there is no cure. I didn't know I was a carrier of the disorder that caused my son's hemophilia. Like many inherited rare diseases, this is not uncommon. It took 9 years for the medical field to diagnose my son's, and the discovery came only after an internal bleed from one of my son's kidneys. My children suffered painful treatments to stop their bleeding complications prior to their diagnosis, and luckily those that were potentially life-threatening didn't take their lives. I'm here to speak on the committee in favor of Bill 3956, the enactment of a Rare Disease Advisory Council on behalf of Hemophilia, South Carolina. But more importantly, I speak to you today on behalf of the approximately 500,000 individuals living in South Carolina whose lives are touched by a loved one diagnosed with a rare disease. I advocate to raise awareness of the 7,000 rare diseases that affect 25 to 30 million Americans. When a family receives a diagnosis of a rare disease, one that is not well known, to be honest, it is devastating. An illness is never easy, but a rare disease, one with little treatment, complicated treatment, expensive treatment, or no treatment at all, is almost unbearable. It can be difficult for state policymakers, government agencies, and others unaffected to have an in-depth understanding of the rare community and the desperate need for an understanding of the challenges and the obstacles patients and their loved ones face. Some examples of the challenges particular to the rare disorders are delays in diagnoses, misdiagnoses, and an undiagnosed rare disorder at birth. Sadly, the challenges I faced with my own children 33 years ago today still exist here and in South Carolina. I experienced 9 years of misdiagnoses with my own children with injuries that should have caused awareness, but instead resulted in improper treatment and complications, and as I said, could have cost them their lives. The pictures I submitted represent unknown diagnoses, delays in treatment, lack of proper care, difficulty with treatment access, and a deficit in the specialty physicians who understand the complex treatment needs for those with hemophilia. An additional challenge the rare community faces lies within our hospitals and emergency rooms. Our rare blood disease partners in the sickle cell disease community share a common bond with bleeding disorders in terms of pain control. This can lead to the unintended bias by those dispensing pain medications against those simply seeking to eliminate an excruciating pain from an out-of-control disease progression. During our partnership each year with the hemophilia treatment staff, who also provide for sickle cell patients at Camp Burton Gin, our state-supported summer camp in Wedgefield for children with special medical health care needs, we experienced firsthand the challenges both families and patients face with rare diseases. Creating a diverse body that represents the rare disease community to advise state government on common obstacles provides enormous opportunities for government officials and the rare disease community to partner together to develop resources necessary to prevent and address barriers. Our comprehensive care hemophilia treatment center within Prisma Health Midstate is still unknown to many, including physicians who treat our community within the Prisma healthcare system. A rare disease council could convene public hearings and solicit comments to identify the most pressing issues facing South Carolina's rare disease community and consult with rare disease experts to improve access to quality health care, education, resources, and treatment. The council could leverage an untapped resource right here in South Carolina with the Greenwood Genetics Center, directed by Dr. Stephen Skinner. He's the medical director and clinical geneticist. Research on genetic disorders is essential to diagnose, understand, and treat these complicated conditions. The Genetics Center's goal is to better define the causes of diseases and disabilities, which can lead to strategies for treatment and prevention. In partnership with the council, they can make recommendations to our state agencies and the legislators. Publishing a list of resources in the state, like Hemophilia South Carolina, will help provide instant education, guidance, support services, and resources in treatment. The Advocacy Council could also help make recommendations for understanding the challenges with affordable, high care cost treatment or no treatment at all, often found within the rare disease community. Our Advocacy Coalition Chair, Crystal Day, explains the struggles she and her family faced several years ago here in South Carolina and still happening today. She's quoted, "My son had a sinus congestion and sneeze, which caused a brain bleed. He was not on preventative treatment at the time due to complicated venous access. He had to have emergency brain surgery and was in the ICU for 4 days, hospitalized for a total of 7 days. And when we were getting ready to go home, the billing department came into our room and asked how I was going to pay for his clotting factor medication. The bill was $3,000 and for his medication to take home, and I didn't have the funds to pay for it. He was only 9.5 years old, and I refused to leave the hospital without it until it was finally given to me. It is imperative that we address delays in obtaining a diagnosis, stop our misdiagnoses, find solutions to the shortage of medical specialists who can provide treatment, and then remove all the barriers to that treatment needed. We must address the lack of affordable access to treatment therapies and medications to treat our rare disease community. And let's identify and distribute educational resources and information available in South Carolina about organizations such as Hemophilia South Carolina that can help families thrive despite being diagnosed with a rare disease. I respectfully ask the committee to please send H3956 to the full committee with your support. I believe that South Carolina has a great opportunity to support the rare disease community, and I thank you so very much.
Yes, thank you, Ms. Martin. Next, we have Ms. Gallagher.
Yes, thank you, Chairman. Can you hear me?
Yes, we can.
Great. Okay, thank you. Chairman Hart and Chairman Howard, thank you for the opportunity to testify today. My name is Rose Gallagher, and I'm the Associate Director of Policy for the National Organization for Rare Disorders, or NORD for short. On behalf of the 1 in 10 individuals in South Carolina with one of the approximately known 7,000 rare diseases, NORD is here today to testify in support of House Bill 3956 to create a Rare Disease Advisory Council that will increase the rare disease patient voice in our state government. NORD is a unique federation of over 300 volunteer health organizations dedicated to helping people with rare orphan diseases and assisting the organizations that serve them. We are committed to the identification, treatment, and cure of rare disorders through programs of education, advocacy, research, and patient services. Typically, the needs of rare disease patients and families do not receive adequate attention from policymakers and state government due to the number of rare diseases and the complexity. To amplify the voice of rare diseases in our state government, NORD launched Project RDAC at the end of 2020, which aims to increase the number of high-impact rare disease advisory councils across our country. At this time, 16 other states have created an RDAC. A few examples close to South Carolina include North Carolina, Tennessee, and West Virginia. H3956 will create a robust state council to give rare disease patients a unified voice in our state government. Additionally, the RDAC will act as an advisory body on rare diseases to the South Carolina legislature and other state departments. It will be tasked with doing 6 main things. First, convening public hearings, making inquiries, and soliciting comments from the general public. Consulting with experts to develop policy recommendations. Searching and identifying policy priorities related to the treatment and services to develop policy recommendations, including safeguards against discrimination or on issues including emergency preparedness. Publishing a list of resources on the state's website, identifying and distributing educational resources for healthcare providers, and finally, researching and identifying best practices to reduce health disparities and achieve health equity. RDACs have proven to be an innovative and meaningful resource to state government with minimal reliance on state funding. For example, in 2020, Tennessee's RDAC successfully passed with a fiscal note of about $60,000 to their state budget. And as part of the 2021 budget in Michigan, they appropriated $70,000 to administer the Rare Disease Review Committee. In 2019, Minnesota appropriated $150,000 each year for 4 years to hire a full-time administrator to administer the council. This is the only RDAC NORD is tracking that includes a full-time employee staff to it. Additionally, several other states recently passed RDACs and received no fiscal impact during their legislative process, including Kentucky, New Hampshire, and Massachusetts. Instead, many RDACs rely on volunteer assistance and outside grant funding to carry out their duties set forth in the legislation. In South Carolina's bill, H3956, there is language that would allow the council to seek outside grant funding for this very purpose. Based on NORD's experience, we feel confident that this language will help ease the burden on the state and allow the council to thrive for the benefit of the rare disease community in South Carolina. South Carolinians who are impacted by rare diseases need increased representation at the state level to meet their varied needs. We urge you to help the rare disease community today by making South Carolina the 17th state with a council and report H3956 favorably out of your subcommittee to the full committee. I'm happy to take any questions now. Thank you for the opportunity.
Representative Bustos.
Thank you, Mr. Chairman. My only question is, does the medical community have anything like this? A central committee or group that discusses rare diseases?
Is specific to the state of South Carolina?
I'm sorry?
I'm sorry, is your question specific to the medical community in South Carolina?
Well, I guess it's the medical community at large. It would seem that they have a vested interest in rare diseases and should have something like this, and they don't, I'm assuming?
Right, not to our knowledge. And, you know, this council would include representation from the medical community, like our doctors, nurses, etc.
Okay, thank you.
Thank you.
Yeah, if you're ready for a motion, I'd make a motion that we, Mr. Chairman, if you're ready to accept motions, I'd make a motion that we recommend to the full committee approval of this. Oh, sure. Oh, I'm sorry.
Ms. Nelson, are you on?
Yes, I am. Can you hear me?
Okay, and we're inclined to vote to approve it. You still have the opportunity to speak. We have about 6 minutes.
It's just one page I have.
Okay, sure, absolutely. Okay.
Fantastic. Well, I would like to thank Chairman Hart and Chairman Howard and the members of the subcommittee for allowing me to speak today. So my name is Carrie Nelson, and I'm the South Carolina Volunteer State Ambassador for the National Organization for Rare Disorders. NORD is a unique federation of voluntary health organizations that are dedicated to helping the 25 to 30 million Americans that are living with a rare disease, and an estimated 1 in 10 South Carolinians are affected by a rare disorder. I'm not only a caregiver for a child with a rare disorder, but I'm also an advanced practice nurse as well. So this is the drive behind what I do as the South Carolina Volunteer State Ambassador. My role has allowed me to meet with others within the rare community, hear their struggles that they're faced with on a daily basis, and advocate for their needs as well. Through enacting a rare disease advisory council in the state of South Carolina, it would provide an outlet for the rare community to be heard. The RDAC would address various issues that the rare community faces, and it would provide support in improving their healthcare needs. My son was born with mosaic trisomy 22, which was a devastating diagnosis that we received 3 weeks after he was born. He's had to live the last 7 years of his life with hearing, "We'll see," which is unfortunately our normal. Had Mason been born with full trisomy 22, we most likely would not have him blessing our lives today, as it is incompatible with life. Mason has spent 2 weeks in the NICU, has had endocrine specialists, cardiologists, and developmental peds follow him throughout. We are now dealing with the stressors within the school system as a second grader. Unfortunately, our story is like so many others within the rare community. However, we are fortunate that Mason is with us today and he continues to thrive, which is certainly not the norm within the rare community. We will continue to fight and attack each new challenge he's faced with, and as he grows, we will see. This last year has also been detrimental to Americans, especially those within the rare community. The already fragmented system was even more challenging for this rare community to navigate. Specific challenges that South Carolinians have faced was difficulty in obtaining care, prescription drugs, and access to their treatments. Through implementing the RDAC, South Carolina legislators and other state decision makers could have a better grasp on these issues and help support the community. So our great state of South Carolina has the opportunity to join the current 16 states who have already enacted the RDAC and show this rare community that we do support them. These 16 states have paved the way and proven that an RDAC is effective and a much needed step in improving healthcare for all. So I do ask that you vote to support House Bill 3956 and show your support to our rare loved ones, because alone we are rare, but together we are strong. So thank you for this opportunity today.
Thank you, Ms. Nelson. And there was a motion by Representative Bustos. Did I hear a second? Moved and properly second that we approve H3956 to the full committee. If Madam Clerk, if you will call the roll.
Ms. Brawley? Aye. Mr. Bustos?
Aye.
Mr. Hart? Aye. Mr. Johnson? Aye. Ms. Matthews? Aye. And Mr. Howard? Aye. All right, it's unanimous.
H396 has been favorably approved to the full committee, and that adjourns our committee for today. Thank you all for your hard work and your great South Carolinians. Thank you.